If you are planning a hair transplant for yourself or anybody known to you, and if you have this question in mind, how much time does the exact hair transplant procedure take? Then this video is made out for you. In this video, we are going to discuss various steps of hair transplant and the time taken for each of them, and run a hypothetical case scenario where we are going to discuss a moderately difficult level of hair transplant with 3000 graft extraction and insertion. So we will be sharing a few clips of 1 minute real-time clips of each step so that you can see each step, how many times is performed and how much time it takes for the entire procedure, because we will sum it up in the end. I am Dr. Satya Saraswat, a plastic and a cosmetic surgeon, and in the field of hair transplant since 2006. I am a diplomat of American Board of Hair Restoration Surgery, International Board of Hair Restoration Surgery, International Society of Hair Restoration Surgery, and various other national as well as international organizations. I am also involved in training and teaching nuances of hair transplant, both FUE and FUT techniques, to a lot of doctors since 2016, and I have trained around 90 or more doctors since now who are very successful in their practice. To know more such useful, informative videos, we request you to subscribe to our channel so that you can get the scientific, authenticated information about the vast field of hair transplant and the latest advances in it. Now coming to the step number 1, that is the preparation which is done before the actual hair transplant procedure start, and this involves various steps like marking the hairline, doing the sensitivity test, and then waiting for some time to see if you are allergic to the medicines which are being used. That is generally the local anesthesia and the antibiotics. Then giving you antibiotic solutions. We also do ECG for all our patients to rule out any cardiac abnormalities. Then we scrub it with a betadine scrub. So all these steps generally take around 1 hour pre-operative preparation time before the actual hair transplant is started. After this, we take our patient to the procedure room, and then as a first step, we make him comfortable. We measure his vitals again, like blood pressure, pulse rate, and oxygen. This is continuously monitored throughout the procedure for the safety purposes, and then we start our actual procedure after making the patient recline. The first step here is to give local anesthesia, and as the term implies, local anesthesia is injected in the local area where the hair transplant is performed. In hair transplant, there are various ways of giving this local anesthesia. One is by giving the nerve blocks at various places, which we used to do like 15 years back, but we found out that the injection was quite painful in that and the results were patchy. So what we have shifted to in last 10 years or so is ring block. Ring block means that the entire hair-bearing scalp is anesthetized by giving multiple tiny pinpricks, and for this step we use very fine insulin syringes which are 30 gauge and very fine needles which give slight discomfort, not too much. Also for this step we use 2 vibration devices so that the pain sensation is further decreased. As we know, there is a theory known as gate theory where the brain has a gate which allows the first sensation to pass on. So we perceive, if we are using a vibration device, we perceive more of vibration sense than the actual pain sense. The pain which you feel while giving local anesthesia is something like an ant bite or a tattoo kind of thing, although it will vary. Pain is very subjective. Some people feel a lot of pain even at seeing needle. We had a patient last week, even before we actually started the local anesthesia, even on touching he was feeling pain, because this is known as nocebo effect, where you start feeling these complications or discomfort even if you have not been given the actual injection. On the other hand, there are many patients who are absolutely comfortable during the entire procedure. In general, it is like an ant bite or a tattoo needle, which is or like a PRP procedure if you have taken it previously, which is very mild. On a grade of 1 to 10, 1 being very minimally painful and 10 being maximum. Generally, patients say that the pain sensation was around 2 to 3 in that. After giving the local anesthesia, we gave a tumescence fluid injection in the field where we are going to transplant. So this tumescence and local anesthesia takes further 30 minutes. So till now, we have seen that 1 hour for the preparation time and 30 minutes for the local anesthesia and the tumescence time. Please do like this video if you are liking the content till now. Now, after giving the local anesthesia and tumescence, we just wait for 5 to 7 minutes for the drugs to take its effect, and then we start with the slit making, which is the first surgical step during the hair transplant. On the screen, on each side, we are showing you 2 clips of 1 minute each, where we are making the slits. So in one of the screen, half of it you can see this will be running for 1 minute, and we will be showing you the number of slits made in each of these case scenarios. So as you can see on one screen, we have made 124 slits in 1 minute, and on the other screen you can see that we have made 128 slits per minute. Considering this to be a hypothetical 3000 graft scenario, this means that approximately 25 to 30 minutes are needed to make these slits. So till now, 1 hour for the preparation time, 30 minutes to 35 minutes for the local anesthesia and tumescence and waiting period, and then further 25 to 30 minutes for the slit making. So that makes it around 2 hours till now. If you have any specific question about the steps of hair transplant, please mention in the comment section below. Now let us discuss the second step of the hair transplant, which is the graft extraction by FUE method. In this video, we are discussing FUE method only and not the FUT method. For this step, we have to turn down the position of the patient to face down position. The table of hair transplant has a gap on the head and side when the patient is lying down prone, that is face down. That gap allows easy breathing and the patients are quite comfortable in that. Now again, we are showing you two screens here on your screen where two different cases of 1 minute clip each shows you the exact number of grafts. So as you saw in these clips, clip number 1 shows that 33 grafts, follicular units, were punched in one screen, and the other screen showed punching of around 34 grafts. So with a 33 graft punch in 1 minute, that means in 1 hour we are able to punch 1980 grafts or follicular units, and in the other one where we are punching 34 follicular units or grafts per minute, that means around 2040 graft punched in 1 hour. So in a case of 3000 graft, taking an average figure of 2000 follicular unit punching in 1 hour, 3000 graft would take around 1.5 hours or 1.5 to like quarter to 2 hours, 15 minutes to 2 hours, 1 hour 30 minutes or 1 hour 45 minutes. So that is the time taken for the punching of around 3000 graft. After this, another 15 to 20 minutes is needed for the collection of the punched out graft. So as we know, when we are doing the punching, the punches, they cut the tethering structures which are holding the follicular unit into the skin. Once the punches are passed over the follicular unit, they cut these tethering structures. The basic, most important of them is the erector pili muscle. Once they are cut, the grafts, they just pop out slightly, and then they have to be collected by a fine forceps or another specialized forceps known as ATOE, traumatic extraction forceps. Punching and extraction of around 3000 grafts would take around 2 hours. So till now we have seen 1 hour preparation time, 30 minutes local anesthesia, 30 minutes slit making time, and approximately 2 hours for the punching and extraction. So that makes it around 4 hours till now. If you are planning a hair transplant for yourself or your family member or anybody known to you, you can call us at the numbers which are shown to you on the screen here. Some of the collection of the punched out follicular units is done simultaneously with the punching of the grafts, and when we are moving from the right to the left side of the patient, the grafts which have been punched previously are collected, and those grafts are taken into the tray at the back end where 2 or 3 team members, they are sorting these grafts into 1 hair, 2 hair, 3 hair and 4 hair grafts. We know that 1 hair is used for the hairline, and there are specific areas where the 3 and 4 grafts are used, like in the frontal tuft region, and the rest of it is spread around. So there is specific use of sorting out this procedure, and this is again a very important step that is done simultaneously. But apart from this, it may take another 25 to 30 minutes for the sorting further. Now after this punching, collection and sorting of the graft has been done, the graft insertion step is started. So again on the screen we are showing you 2 screens of insertion by 2 members. Please remember that there are, in any team, most of the team, there are 2 people who are inserting the graft, one on the right side and one on the left hand side, and we can see 2 such clips in two different patients on the screen here. So you saw that insertion part, both the cases, two team members were able to insert 18 grafts per minute. That means around 1080 grafts per hour. So that means in a case of 3000 grafts at an average speed of around 1000 to 1100 graft insertion per hour, this step is going to take around 3 to 3.5 hours. As we go towards the end, adding more and more grafts into the area where the insertion has already been done, and to improve the density, we have to add or insert some graft between the already inserted graft to add more density. The time duration slightly, the pace or the speed of the insertion step slowly decreases at the end of the procedure. So for 3000 graft insertion, that would take another around 3 to 3.5 hours time for around 3000 grafts. So till now, 1 hour preparation time, 30 minutes local anesthesia, 30 minutes slit making, 2 hour extraction, and around 3 to 3.5 hours of the insertion time. That makes the complete procedure, the time duration, like around 7.5 hours. Friends, we do give some breaks to the patient, like a lunch break or a washroom break, or they have to in between take some break like that. Those breaks roughly are around 1 hour. So you can see that a case of 3000 graft is going to take anything between 8 to 9 hours. If you want to know specialized grade-wise hair transplant and the planning for that, please click the video on the link given above. So friends, we saw that a 3000 graft is going to take around 8 to 9 hours, but this is never an exact figure. There are various situations in which the hair transplant may become easier or difficult. There are patients with very good skin where once we just slide the graft, it just sticks over there. Whereas on the other hand, there are some patients who have slightly higher amount of bleeding, excessive bleeding, or condition like popping, where if you put one graft, the other graft will come out, or if the skin is slightly on the harder side, or if the hairs have a splay. There are various specialized circumstances or situations where this time duration can slightly decrease or increase also. And if it is a difficult case, it may take up to 10 hours also, including the preparation time and the break time and all the steps which we have discussed here. Please share this video with people you know who are planning out a hair transplant for themselves, so that it can be of use to you or use to them. If you want to see one of our latest hair transplant patient, please click the video on the left. And if you want to know more about medical treatment for hair loss, you can click the video on the right. Thank you very much.